Sacramento, California, known as the City of Trees, and chlamydia. Yep, Sacramento saw the fourth highest rate of chlamydia in the entire country. And for the 14th year in a row, Sacramento County has become the statewide leader in sexually transmitted diseases. Matter of fact, Oak Park's community clinic is where the majority of Sac County's high rate of chlamydia is discovered. And the majority of the people infected or at risk are young, lower-income African Americans. To top it off, California's Department of Public Health shows that youth ages 15 to 19 as well as 20 to 24-year-olds are hit the hardest, with the biggest impact being on females compared to males. So what is chlamydia? Chlamydia is an infection that spreads through sexual contact. This infection infects the urethra in men, and in women it infects the urethra and the cervix and can spread to the reproductive organs. It is the most common sexually transmitted infection. Chlamydia does not cause problems if it's treated right away, but left untreated it can lead to serious problems, especially for women. If it spreads, it can cause pelvic inflammatory disease. This infection can make it hard or impossible for women to get pregnant. Pregnant women who have chlamydia often pass it on to their babies at birth. If the infection spreads, it can get in the baby's eyes and cause blindness. They also have other problems like pneumonia, and pneumonia can be a deadly disease in newborns. Having chlamydia makes a person more likely to get HIV from someone who is infected with HIV, and HIV is a virus that can cause AIDS. Since African Americans are disproportionately affected by AIDS, infant mortality, and blindness across the country, it only makes sense to help reduce these occurrences by fighting to reduce the prevalence of a disease like chlamydia that promotes AIDS, infant mortality, and blindness. So how do we fight chlamydia? Well, just remember it's easier to prevent an STI like chlamydia than it is to treat. For one, don't have sex with more than one person at a time. The safest sex is with one person who has sex only with you. Every time you and a new partner have sex, you are being exposed to all the infections that partner may have. Remember to use a condom every time you have sex. Latex and polyurethane condoms keep out the viruses and bacteria that cause STIs. Remember to be responsible. Don't have sex if you have symptoms of an infection or if you're being treated for an STI. And if you're wondering what the symptoms are, they may include pain when you urinate, cloudy urine, or abnormal discharge from the penis or vagina. But just remember, most people don't have symptoms. So wait to have sex with a new partner until both of you get tested for STIs. With personal responsibility and safe sex practices, we can help reduce the prevalence of chlamydia affecting the people of Sacramento, and especially the lower-income African American community. Let's continue to be known as the City of Trees and not the City of STDs.